Lee Clement. I'm here to talk to you this evening about pediatric flat feet. This is a condition which many parents are faced with small children, but hopefully what you'll understand by the time we complete this is that it's not near as big a concern as you think it is. You're going to find yourself as a parent trying to deal with deformities, life changes, so many issues with a child, and one of the things that you will be faced with potentially is flat feet. Presumably the reason you're here this evening is you have a child or you're guardian of a child who has flat feet and this bothers you. I can share a quick story about a child that I know, Caleb. He's 7 years old, and from the time he was born his parents noticed that his feet were in fact very flat. So much so that when he stands up now it actually appears as though he's sometimes walking on his ankles. They've taken him to the doctor, they've had him checked out. The doctor told him that nothing was wrong, his feet were fine, he would develop fine, everything was okay. They obviously didn't believe him because they see the feet, and flat feet is something that we don't think of as natural. Flat feet medically are known as, the term is pes planus. Basically it's any foot that's described as either having little or no arch. This can be because of a birth order situation or maybe even fallen arches at some point. We're more interested with the ones that start out that way. Flat feet can basically be broken down into a couple of different areas. You've either got flexible flat feet or you have rigid flat feet. Most cases with children, you're dealing with flexible flat feet. If you'll notice there in the handout, you'll see the 7-year-old pictures. The 7-year-old pictures, that child is considered to be flat foot. He has what is determined as flexible flat feet, which in most cases doesn't cause any problems for him at that age or even as an adult. The easiest way to tell the difference is you look at him when he's standing up with a weight on his feet and they are in fact flat. When he gets off of his feet, he raises them up where you can look at them. You'll look there in the next picture, you'll see that there is an arch. Now flexible flat feet can be associated with things like Down syndrome and cerebral palsy, but the doctor in doing his assessment of those feet is going to be looking for all those other things, and there's so many other symptoms that are associated with those situations that flat feet's not the only indicator. So need not panic there. With rigid flat feet, the child is going to be flat-footed when he's standing up. If he sits down and takes the weight off his feet, they're still going to be flat. These are generally the ones that cause more problems. You're looking at arthritis, a situation called tarsal coalition. Tarsal coalition just simply is where some of the bones did not separate at birth like they should have. And as a child develops in those early stages, as he starts to walk, there are so many variables that are involved. The tendons may not exactly grow right, the ligaments may not grow exactly right, maybe the bones don't separate like they're supposed to. This can lead to the rigid flat foot, and in most cases the most identifiable symptom of rigid flat feet is pain. This child is going to complain a lot with his feet hurting, and yes, take them and have them checked with a doctor. Flat feet is so common, as a matter of fact, in small children. At age 2, according to one study, 97% of all children are flat-footed. By age 10, only 4% are flat-footed. This is not an uncommon thing, and I guess this is what we want to get across today. If your child has flat feet, this is something that you're concerned about. Listen for the child's conversations, listen to how he talks about his feet, take him on long walks, see how he reacts in different types of shoes. By all means, shop for shoes that fit the child. But there's no sense in running out and buying orthotics. In most cases, orthotics are not going to do anything but improve the wear of the shoe. It's certainly not going to cause a permanent fix in the child's feet. Once you've seen the doctor, he tells you it's okay, the child doesn't have permanent issues, you can relax. He'll have a nice, healthy life. He'll grow up, be whatever he wants to be, and the flat feet won't change anything. Now, can I take any questions from you? Yes.
Is surgery ever an option for children with the flexible flat feet?
Surgery can be an option, but with flexible flat feet, normally the doctors don't consider surgery simply because there's really no major issues. There is a group of doctors over in Italy that is working on a biodegradable screw that they can put in. They've decided that because of all their research, that young adults actually start experiencing minor low back pain, and they think that it's due to the flat feet that they've had their whole life. But again, you're talking about children, and you're talking about trying to read children's pain and understand what they're telling you. So the results, whether there's low back pain or not, are fairly non-conclusive. But yes, there are options out there to consider. If you want to go that extreme, I'm sure you can find the right doctor that'll approve it. Anything else?
What if you're a parent and you're concerned about your child? Should you wait till they're school age, or should you go ahead when they're toddlers running around when you first notice it to have it checked out?
Based on the research and from all the studies, at an early age, up till 2 or 3 years of age, there's nothing to worry about. The child's really still learning to walk. They've got the fatty deposits on the bottom of their feet that they're still waiting to grow away. Once they're at that good running, active stage, that's really when you can start evaluating it. But again, from the research that was done, most doctors aren't going to do anything with that child until after age 10 or 11, because they're going to give that foot and that body time to develop to essentially what is its final stages. If the child then is still complaining, starting to have pain, then you need to see the doctor. If the doctor's not giving you the answers, go find another one. There are pediatric orthopedists. Most all large cities have them, so if you live somewhere where you don't have one, seek one out. This is what they deal with probably 90% of their practice, and they can give you the answers that hopefully you're seeking to take care of your child. That'll be all. Again, most cases are flexible flat feet. Go home, take these pictures, evaluate your child's foot. Hopefully you'll breathe a sigh of relief and get a good night's rest. If not, find you a good doctor, find 2 or 3 good doctors, and let them evaluate the child. Thank you.